Hey guys, what's going on? So I want to talk about health anxiety and back pain. This is something that can be associated with health anxiety, general anxiety, panic attack or panic disorder, and just general stress, okay? The back area can be very freaking sensitive whenever it is affected by stress. So kind of my backstory very quickly. I had my first panic attack after a 2-day bender. Basically, I was drinking a lot. Woke up, had depersonalization, derealization. My heart rate went up. I had chills. I had shakes. I had numbing, tingling, blurred vision, irrational thoughts. It was nuts. And then I just felt tightness in my chest. This lasted for 6 total hours. Blood pressure was through the roof. My chest hurt for 3 days after that, and 3 doctor's appointments later, I kind of started to believe the doctors, and I kind of moved on from there. But if you have health anxiety, or you suffer from, or if you're a hypochondriac or suffer from hypochondria, which is essentially the same thing as health anxiety, it doesn't end there for most people. Once you graduate from one symptom and think that you have a handle on it, other things happen. You start to get worried about this. So I moved on to like IBS, cancer, things like that I was nervous about. The unbelievable amount of stress that you put on your body really will, create other symptoms that are very, very real. They're not fake. You're not imagining them. You're just focusing in on them, and you can exaggerate it in your mind. That's for sure. That's something that's crazy about having health anxiety or being a hypochondriac. Yes, some things can be imagined, but usually it's just you're more aware of something, and you're very tuned into that, and you blow it up. Something that might be you could feel 5%. Whenever you're just a normal person, you're feeling it like 75-fold. It's nuts. It's crazy, unfortunately. But the back pain for me was mainly just it wasn't something that I worried so much about. I wasn't scared of some crazy disease that I might have from experiencing the back pain. But it was just a hassle. I knew it was a symptom of my anxiety and stress on my body. I wasn't sleeping weird or wrong. I just remember gradually, probably, 3 to 6 months into my health anxiety journey, make it sound so glamorous, which I went through this for about 3 to 4 years, and I pretty much have gotten 95% better. I still worry a little bit sometimes about my health, but I have the tools now that I possess those tools that can help me cope with it and brush it off my shoulder. For the most part, I still have little struggles, but my back pain just started to kind of creep in, okay, and at first it was just when I woke up. I'd wake up out of bed and I thought I was just sleeping wrong, or maybe I needed a new mattress or something, and then that kept happening and happening and happening. Now, where was my back pain? It was in different spots at different times. Most of my back pain actually was in the upper back and not the lower. I know that's not as common, but I just had it felt like knots. And at first I just didn't think it was the anxiety. I was like, nah, I've heard that, like you see people giving massages and they're like, you're so tense, and you're like, that's just, you don't believe it until it actually happens to you. And it kept getting worse and worse. And I remember I was working at my job, the job that I had, and I just remember just walking like a hunchback almost. I was just kind of walking around like all crippled, like, because these knots, man, they were just like twisted in there. I would get my girlfriend at the time to rub my back, or I would see if my mother would do it or something like that, and I would feel a little bit of relief, but it was just my body was so tense. It was unbelievably tense. This really affected me. Now, I also learned something else. It is very, very easy to pull a muscle in your back or injure your back whenever you are going through an intense amount of stress, okay? I kid you not. I was jump roping, especially if you don't exercise that often. I was trying to get in shape. I was like, I'm going to exercise. This is going to help me with my stress. It's going to give me confidence that I'm not dying, that I don't have a heart problem. And I started doing jump rope. and probably about 35 to 40 jumps in, it felt like my whole lower back fell out. Okay, so mind you, I've been dealing with upper back pain, mainly knots in there. Okay, just tensing up. They would, they would be extra. They would the best way I can explain it is like a burning. It was like a burning sensation because those muscles were just like tightening and then like maybe twisting a little, creating these little mini knots, if you will. And that's what I had been dealing with. But now this exercise thing, okay? I'm jumping, like I said, 30 to 40 jumps in, and just bam, it's like the whole bottom of my back just fell out. And it turned out that I had just pulled a muscle in my lower back. I'd always considered myself to be in good shape, but you're more susceptible to injury whenever you have a lot of tension in your body and a lot of stress. Okay, things aren't working as well as they usually do. I was usually always dehydrated at this time. I was drinking too much at the time, and I had major IBS, which led to diarrhea, so I was always deprived of water. I probably didn't have the best habits when it came to drinking just H2O all the time. There were sodas mixed in, and other things. Tea and juice. I wasn't huge on water until recently, probably about 2 to 3 years ago. 90% of my drinking is water, okay? So just a little tidbit there. Drink more water, stay hydrated, especially if you got anxiety, because if you're trying to exercise, like I give you that advice, you need to exercise, you need to get out there and do it. But beware that you can pull muscles, okay? And your back and your lower back when working out and dealing with anxiety are very injury prone, okay? So keep that in mind. Now, that happened to me, and it probably hurt me for about a week and a half until it started wearing off, until I could get out there and start doing other things. I didn't start jump roping or anything crazy. I just started running because I was scared to death I was going to throw my back out again like an old man, okay? So that's another thing you need to watch out for, and that's, if you're going through this back pain, don't just automatically assume that you have some horrible disease, that you have some spinal or bone cancer or whatever, okay? If you're going through horrible anxiety, back pain is one of the most common symptoms you're going to get. And I don't talk about back pain that much. It's funny. It's one of the most common symptoms, but we all seem to think about the chest area, or headaches or IBS or, heartburn, things like that. Blurry vision, irrational thoughts. We don't necessarily think, back pain is the number one thing, but that is like up there, probably in the top 3 to 5 symptoms of health anxiety or anxiety in general, stress related symptoms. It's going to be back pain. Okay, so keep that in mind. Another thing you need to worry about, all right? I say worry about like we need anything else to worry about. We think we're dying every day already. That wasn't a good one, Trey. But make sure that you're sleeping on a good mattress, okay? If you need to go to the store and buy them, like, I don't even know what you call them. It's like the foam things that you put on top of your bed. Do that, because while you're trying to recover and while you're trying to get out of your anxious habits and rewire your subconscious, if you got any problems with your mattress, it's going to lead to back issues, especially when you get up, because first I had dealt with the upper back stuff, and then I threw my back out, and then it started to seem like later on, every morning I got out of bed, it was a big issue. I would get out of bed. I remember waking up and just lifting myself up, and I was like, OMG. I was like, are you kidding me? Then you start feeling every little dent in your mattress, every dip, every issue, flaw with your mattress, you start finding it, okay? I'm not saying this is going to happen straight off the bat, but if you've been dealing with back pain from anxiety for a while, I think I'm able to relate with a lot of you. So there you go, guys. Knots and tension with your back. You are more prone to back injuries. And make sure you're sleeping in a good situation, whether that be a mattress or couch, whatever it is. Make sure it's got good back support, okay? Make sure some things that you can do to fix this, guys, is make sure you're hydrated. Be careful and work your way into exercise. Make sure you're stretching. And work on your anxiety in general. Work on it, okay? Like I said, you need to eat right. That helps you with your brain chemistry. You need to work on your meditation. It's powerful. It's more powerful than you think. It's not cheesy. I thought it was cheesy. Go look it up. I hope that I can eventually be good enough to actually make an instructional on that, on meditating. But go look it up. It's very powerful. There's some people out there that can teach you how to do it. It's just in the mornings and evenings, okay? Whenever you wake up in the morning, your mind is close to your subconscious. Right before you go to bed, your mind is close to your subconscious, okay? That's the two best times that you can have the most influence, all right? And you need to be positive, guys. It's very hard to be positive when you go through this. I'm telling you, I know that for a fact. I struggle with this. I still struggle sometimes on a daily basis on being positive. And I don't really have this huge monkey on my back as far as anxiety goes. I seem to be a pessimistic type of person. I've gotten better, but I still struggle sometimes. So you got to work on being positive. If you got to, go the route even of looking up of looking up positive affirmations and listening to those, or getting tapes or CDs or DVDs, or just finding some some cool YouTube videos on that, then do it, because maybe you need that. Maybe it'll work for you. You got to try everything. So what did I say? I said diet. You need to work on your exercise. Make sure you're stretching for that. Stay hydrated. Positive thinking, meditation. All right, guys, and those are the biggest tools that I can give you. You got to practice those every day. There's not just a magical fix. Some people will one day wake up and not have to deal with it. Most of us don't. It's a gradual thing. You got to work at it. So join that Facebook down below in the description, please. We're up to like 24 members, I think, which is growing every day. I'm getting somebody in that group, and that's a great outlet for support. Another place for you to catch my videos and relate and talk and connect with other people that are going through the same thing as you. Okay, that's going to be, I think it's anxiety, stress, anxiety, and panic attack help or support. It's right down there below. So click that in the description. Also follow me on my social networks. If you haven't subscribed, please subscribe to my channel, and also hit that notification button next to it to get updates whenever I make my videos. Like this video so I can get up there in the search ranking, and also leave me a comment if you have suffered from back pain because of anxiety. Let me know what symptoms you dealt with. What did you do to fix it? Has it gotten better? Has it gotten worse? Let me know down below. Thank you guys, and you have a good evening.